I'm joined by Dr. Toursarkissian. Doctor, just tell me a little bit about carotid artery disease. Just tell me how can we figure out if we have this, kind of what some of the symptoms are.
Yes, ma'am. Carotid artery disease refers to blockages in the carotid arteries in somebody's neck. We have one carotid artery on each side of the neck that supplies blood flow to the brain. And for a variety of reasons, at times people can develop blockages in those arteries. And those blockages can sometimes lead somebody to develop a stroke. There are multiple causes for those blockages. The most common is atherosclerotic, which is hardening of the arteries. It's a systemic phenomenon that affects arteries in multiple beds in the circulation. The carotids is one territory where it can happen. So if an individual has blockages in arteries in other locations such as the legs or the heart, they potentially have the risk of having blockages in the arteries going to the brain. So who should be screened for these conditions? There's a number of risk factors associated with blockages in the arteries, and the most common ones are things like smoking, diabetes, uncontrolled blood pressure, uncontrolled cholesterol, history of radiation to the neck, family history of similar problems. As far as testing it, it's a relatively simple, painless, non-invasive ultrasound test, which can be done in a number of radiology office settings or even primary care doctors' offices, that would give you an idea of how much of a blockage you have to know whether this is something you have to worry about or not.
Now, what does treatment look like, and how is the Vascular Institute of San Antonio, how are you best prepared to treat people?
Well, the treatment in the majority of the cases is going to be medical, not necessarily surgical or interventional. That is because the majority of people don't have really high-grade blockages. It's still important to identify it because you would institute general preventive measures, such as the use of an aspirin or an antiplatelet agent, the use of cholesterol-lowering agents such as statins, and generalized things such as control of blood pressure, control of sugar. At the Vascular Institute, we deal with these basic cases as well as more advanced cases where the blockages are much more significant. Because the more significant the blockage is, the higher the risk of somebody developing a stroke. And there are situations where the risk of surgery then can be justified to remove the blockage. And so we deal obviously with the medical aspect of it, but we also deal with the surgical or endovascular treatment of the blockages, because there's two ways. Once you've decided somebody needs something more than medicine, there's really a couple ways to treat the problem. One of them is with a conventional operation where the vessel is cleaned up. The second way is to put a stent to open up the artery and tack the blockages open. And there's advantages and disadvantages to each approach, and we would tend to select out whichever one we think is best based on the patient's anatomy and overall risk situation.
Now, this is great information. If people want to find out more information about the Vascular Institute of San Antonio, where can they go? Well,
certainly you can look at our website, Vascular Institute San Antonio, or if you want general information about vascular condition, I would suggest the vascularweb.org, which is a website that's sponsored by the Society of Vascular Surgery that provides general information on vascular conditions.
Thanks, Doctor. I appreciate your time today.
Thank you very much.